As you know, we are celebrating World Hemophilia Day. Every year, our World Federation of Hemophilia promotes World Hemophilia Day on April 17, a tradition dating back to 1989. This year, it coincides with our organization's 60th anniversary. Traditionally, we celebrate the birth of our founder, Frank Schnabel, by promoting news, events, and various activities that generate buzz in society. We leverage this impact to raise awareness about hemophilia and other inherited bleeding disorders, promoting equitable access to diagnosis and appropriate treatment for all patients worldwide. The WFH mission is to improve and preserve care for people with inherited bleeding disorders, such as von Willebrand disease, guided by our vision of treatment for all. We choose to highlight a particular theme each year. For example, in 2025, the central theme was access for all. Women and girls also suffer from bleeding, emphasizing gender inclusion. Historically, the WFH, along with all its national member organizations, that is, our single and official representation in each of the 152 countries worldwide, uses this day both before, during, and after to increase the visibility of this chronic complication, which becomes even more impactful when patients suffer prolonged internal bleeding due to a deficit in clotting factor that prevent such bleeding. At the same time, the day serves as an opportunity to bring together patients with their families, healthcare professionals, and even health authorities, all of whom are essential components of a system that is crucial for achieving a better quality of life for all our patients, wherever they live, and regardless of gender, ideological or religious affiliation, economic, educational, or cultural background. The appropriate role for our national member organization worldwide has been in a way to leverage this celebration to disseminate information through media outlets such as newspaper, radio, television, and more recently, social media, highlighting all the details I just mentioned. This has been accompanied by events such as illuminating in red color painting or raising monuments, fountains, buildings, bridges, etc., to try to get the attention of the public. From my perspective, our NMOs must not forget that they bear the responsibility of trying to influence the decision of health authorities. In other words, they should use this opportunity to promote public policies that help improve access to prophylactic therapy and early intervention in the event of any episode. Our national member organization, rather than simply organizing a party or social gathering, should focus not on the event itself, but on the fact that by holding any event, they can influence the decision makers in an environment created around hemophilia. This decision maker can listen to proposals that will help them better understand the benefit of achieving early, continuous, and sustainable access to treatment for patients suffering from bleeding disorder such as hemophilia and von Willebrand factor deficiency. I recommend and encourage all our national member organizations, wherever they may be, to define ambitious yet achievable goals from one to three objectives, depending on each organization's resources, and prepare these goals well in advance of April 17th of next year, clearly determine the benefit that achieving each goal would bring to the community and establish success indicators. Only then should they consider what activities are possible and necessary to reach those goals, but not be so passive as simply illuminating buildings and fountains. These illuminations should serve to enhance the impact that our NMOs want to achieve, whether with health authority, government, treatment centers, or even the community at large. This year, 2026, the theme we have chosen for the World Federation of Hemophilia Disease, diagnosis, the first stage of care, emphasizing that diagnosis is the essential step to accessing appropriate treatment and improving the quality of life for people with inherited bleeding disorders. Given this central issue, our national member organization could help globally reduce the enormous gap that exists between the estimated number of hemophilia patients worldwide and the number currently reported as diagnosed, which reaches just under 35% globally. Therefore, one goal could be to promote campaigns that achieve accessible testing in all regions, including remote areas, and to include training for laboratory personnel, obtaining the necessary regions for screening and all tests to ensure accurate diagnosis, and also emphasizing younger populations, since early diagnosis will help ensure effective treatment. It's also important to include women and girls who, for many years, were not considered likely to have any bleeding disorder, much less hemophilia. These myths and paradigms are now being dismantled. Finally, I want to remind you that all these efforts and actions that our national member organizations are expected to carry out could be imbued with a positive message, seeking to influence decision makers and relevant authorities. Currently, our hemophilia community, led by our World Federation, has accumulated a wealth of scientific evidence recorded in large databases such as the Anna Global Survey and WBDR, which demonstrated with indicator the progress made in the world of hemophilia, the improvement in quality of life, thanks to prophylaxis starting at an early age. The success of preventing treatment with non-factor agents has been remarkable, achieving new goals in the treatment of patients with severe or moderate hemophilia. With the increasing number of cases being identified, these patients are now experiencing zero bleeding per year or no more than 2 bleeding episodes per year. We also have many other advancements to celebrate, and we commemorate these successes every April 17. In recent years, this day has been accompanied by good news and great optimism for what the medium and long term may hold, provided we can convince decision makers worldwide to support this treatment for our patients. Thank you.